I seem to hear a lot from patients asking about some of the new treatments for facial rejuvenation, such things as the contour thread lift or feather lift or liquid facelift. Thermage is another thing that's popular and people ask about. I would wrap all of these into a category of non-surgical or minimally invasive treatments for facial aging. And minimally invasive surgery has been an interest of mine for the last 15 years. However, what I've learned over the years is that to truly make a difference and make someone look truly younger, it usually involves good old-fashioned surgery. I wonder, what's the motivation behind all the mini lifts or non-surgical procedures? I sometimes think it's the fact that as people, we're having a hard time coming to grips with the fact that we need a facelift. So we use a mini or a feather or a light touch or a laser. And I believe as we get to that point in our life, suddenly we realize we do want that or we do need that. And all of us get there eventually, whether we admit it or not. It's a point in your life when you realize, I'm aging and I want to do something about it. And so I think what we want to achieve is a youthful look that's natural. And it's not so important how long the scar is. What's important is that we look good. People are starting to realize what they really want is a natural look. They don't want a wind tunnel look. And now that we've had more experience with some of the so-called lunchtime facelifts, we're realizing that they don't truly provide much results. Unfortunately, there's many practitioners out in the marketplace that perhaps are not trained as board-certified plastic surgeons, and the only option they have are non-surgical or mini surgery procedures. Whereas these procedures might be just right for a minority of the population, many patients will spend money and get poor results. And this is because it's hard for the patient to know what will work for them. As a professional and as a board-certified plastic surgeon, I've used the full repertoire of procedures, and I've learned what works for different types of faces. And so I can sit down with a patient and explain why we have chosen one particular procedure over another.